Humans have been fighting tuberculosis for over 9,000 years, and according to the World Health Organization, in 2022, millions and millions of people were affected. It's one of the world's most infectious killers, second only to COVID. How did it become so dangerous? The disease spreads through the air, or more specifically, through droplets from people infected with TB. This can happen when they cough, sneeze, or talk. The danger of these droplets increases if the immune system is weakened, for example by smoking, drinking alcohol, or having diseases that attack the immune system like HIV. If someone catches TB, the first symptom is usually a persistent cough that's hard to stop, which may eventually bring up blood. Chest pain becomes severe, accompanied by fever and chills. Appetite decreases and, over time, weight loss follows. The culprit behind this lung disease is actually a bacterium. Interestingly, even for those of us who are healthy, TB bacteria might already be present in our bodies. However, our immune systems may be so far winning the battle, so we don't get sick. What's scary is that these bacteria can remain dormant in our bodies and only become active after months or even years. TB bacteria were first discovered in the 19th century by a scientist who later also received a Nobel Prize in Health. Since then, we've understood the disease better and developed more accurate treatments. The history of TB treatment is both fascinating and a bit scary. In the early days, in England, the number of cases went down significantly. That's great, right? Absolutely. But then TB cases there started to increase again by the 21st century. How was that possible? It's because of antimicrobial resistance. If the antibiotics are not used correctly, for example, if someone doesn't take their medicine as prescribed, doesn't complete their 6-month-long treatment, or if the doctor prescribes the wrong dosage, the bacteria don't die. Instead, they adapt. Now, these resilient TB bacteria have become the most common type. The problem is that this super TB bacteria is harder and more expensive to treat, requiring 2 years of treatment and a total of 15,000 pills down our throats. Compare that to the treatment for regular TB bacteria, which only requires 750 pills. And even though TB is caused by bacteria and not a virus, there is actually a vaccine for it. It's called BCG. This vaccine trains our immune system to be more effective in combating the deadly tactics of TB bacteria, should we ever get infected. Unfortunately, its effectiveness has diminished since the vaccine was first introduced a century ago. This has become a big question mark for researchers, many of whom are working to develop a more effective TB vaccine. To this day, TB remains a significant health problem, especially in developing countries. As much as 95% of TB cases and deaths occur in developing countries. Poor nutrition, living in densely populated housing with poor ventilation, and exposure to air pollution all make the bacteria thrive even more. So, eradicating poverty could be one way to tackle TB. Currently, many organizations are planning to completely eradicate TB. Looking back at history, humanity has successfully eradicated one disease, smallpox. Can we do it again?